Hello everybody, Hassan here from Galaxy Invest. Just a reminder, this is not financial advice. Please do your own research. So quick note, I really appreciate everyone who's subscribing. There are many new subscribers to this channel. The goal of this channel is to raise awareness of genomics, specifically gene editing technologies across all platforms, including YouTube. So I really appreciate everyone who's subscribing, liking our videos, and even leaving valuable comments in the discussion section below our videos. So I really appreciate it, guys. And for those who haven't subscribed yet, please do consider subscribing. Again, it helps not just the channel, but the community itself, right? We need to support each other in the genomic space. So this is a great way of supporting. So please do subscribe and even like our videos. So in today's video, I want to discuss about an interview that happened and that was published in Seeking Alpha today. It's a transcript. I couldn't find a webcast video, but the transcript will do. And this was an interview with Lawrence Klein, who is the COO of CRISPR Therapeutics. We made a mention of this person in the past. He obviously is a very important figure in the company. And I do believe there's value in looking into this transcript today to see if there's any hidden gems. Someone do something similar to what we found in Dr. Sam's CRISPR Therapeutics CEO hidden interview that I published a few days ago that many of you have liked. So hopefully you guys will like today's video. So what I'll do here is I'll minimize my face here so you guys can see a little bit more of the screen. So let's put it like this. Okay, so let's just zoom in maybe. Okay, so let's see here. What can we find here? So the the webcast basically starts with Mr. Clean basically going over the company, right? A quick 10 minutes overview. I don't believe we really need to dig into this, but he does go over all of the past historic information about the company, the current programs in their pipeline, and of course where they plan on heading. So great information here. They go through the CTX001, they go through CTX110, 120, and CTX130. They talk about the type 1 diabetes partnership with ViaCyte. And they also talk about the in vivo future approach that they have in their pipeline as well. So definitely great information here. Again, this is very high level, nothing too new here. I will link the transcript in the description, so please do feel free to read it so that you can sort of get yourself a good grasp of how is the COO thinking about these companies. And it is important to see not just how the CEO is thinking about the company, how the leader of the company is looking at it, but also the rest of the leadership team, right? In this case, Mr. Clean. So basically the first question goes on and they talk about how they basically talk about just CRISPR based approach in gene editing. And then this is very high level answer, but there's a really nice answer that is answered and I really want to highlight is I think it's gonna come after, but let's just go down here. Okay, so now they're heading into the CTX001 specifically, and now they're talking about how they have dosed over 20 patients and how the results are promising. And they talk about how even the longest patient is over 2 years now out. So looks like a very stable program. The data looks promising. Things are looking good. There's a good question here that talks about regulatories, right? It talks about regulations. And what's really interesting is this sentence here, right? So we have the advantage of number of different designations with regulatory authorities, including RMAT in the US, which allows us to have a number of early dialogues with agencies on requirements for filing. Very interesting, right? So what the CEO is mentioning here is that they have sort of a shortcut to some of the regulators to get those early discussions going. I don't think it's really clear as to how those shortcuts are compared to other competitors in this space, but it is what it is. That's what he just mentioned here. He does talk about how there's a process going on, those discussions going very well. And we've made a mention this in the past where Dr. Sam has mentioned that they are fully confident, they being CRISPR Therapeutics, they are fully confident that the FDA approval will cost less and will go faster as time goes on, as CRISPR Therapeutics is able to go mass market with CTX001. All other programs in their pipeline will not take as long and now will hopefully not cost as much for them to get approved compared to what CTX001 had to go to. So that's basically what the discussion point is, and this is what they're sort of talking about here. And then over here, they're talking about plans on going commercials, right? So we made this mention in the past where CRISPR Therapeutics are sort of positioning themselves to go commercial, right? They hired Philippe Douet, which is a veteran in this space, and they hired him just under 2 months ago, and he's the chief commercial officer, which means that this company is planning to go commercial, right? So they talk about their partnership with Vertex, and this is a 50-50 co-development cost and profit share arrangement. Very, very interesting, right? And obviously they talk about how this partnership has been positive and how Vertex has been giving CRISPR Therapeutics a significant amount of investment to go through all this R&D setup and expenses that they've been going through for the past years and so on. And here he mentioned we do have the lead commercialization in the US, but we worked very closely, very collaboratively. So some of the work is ongoing, okay, so there's a lot of thought, sure. Okay, so just some general information here, nothing too crazy so far. I do like this note here, what Clean is making out of this question. So basically the question is, what's the timeline, or right? What's the idea of going mass manufacturing CTX001 potentially, right? And Clean basically says, hey, there's a big advantage we have with 001, which is CTX001. We don't believe we need to make any major modifications to the manufacturing process that we started with, right? So this is really interesting, right? And they're basically saying that, so you can they're talking about here, so to treat a patient cells come in and they're processed in the suite, right? And then they're shipped back to the facility. So you can just basically clone those suites, and then the more suites you have, the more output you have, right? So it's fairly scalable. And then they're talking about basically the idea that CTX001, for it to go mass market, they don't actually have to modify that much the way they're doing things. All they have to do is just clone those suites, and those suites are basically what they need to basically get patient cells treated, right? So this is sort of a reference to how they believe they have an advantage in going commercial, in going mass market, the way CTX001 stands and the way they're doing things currently. Basically, the only need is to clone those suites, and this is, according to what Clean is saying, this is very, very a big advantage for the company. So very interesting to see the COO take this stance in this interview, right? So, and then obviously the next question comes in. They start talking about the CAR T programs. Again, if you haven't seen our video with last weekend's CAR T breaking news that they had, so they updated us with results in their CTX130 program. But obviously, there's two other programs in that with everything to do with the CAR T program. So basically they're giving us updates here, and they're talking specifically about 110, where results are promising, it's looking good. They're talking about how short term it may not look like those results are looking that good, well, but after the 6 month mark, things are looking very positive. It's very clear that what they're doing, what CRISPR Therapeutics are doing in this space is very effective, and it needs to be effective because it is a competitive space. Other companies such as Antilia are also implementing CAR T programs in their pipeline. So very interesting to see that stance. And then we basically talk about the ViaCyte partnership, which obviously, as we mentioned in the past, it addresses the type 1 diabetes issue, that hopefully they can eventually tackle type 2 diabetes. They don't mention the type 2 diabetes in this interview, but just know that type 1 diabetes, yes, when we talk about diabetes, we're most likely referencing to type 2 diabetes for severe cases, but type 1 diabetes is like, getting your feet wet, right? Once that's tackled, then type 2 diabetes will eventually come, right? Think of like a stepping stone, right? Again, we all want to eradicate a specific disease as fast as we can, but the truth and the reality is these types of things take time to go through all these protocols, all those regulations, and basically you need to also assess, what are your costs, what's your from going to point A to point B, what's the timeline, what's the cost, what's the fees, what's the regulation looking like. So that's the idea behind this partnership with ViaCyte with type 1 diabetes. Type 1 diabetes is still a big problem to tackle on its own. So very interesting to see them do that. And then obviously they talk about their in vivo approach. Okay, so we'll end the video like this. So hopefully you guys found a lot of value of just looking over this hidden interview. Basically, it's not covered by legacy media, unfortunately. Um, and this is the goal of this channel, right? It's to raise awareness of this space. So I really appreciate if you guys can share this video, like, subscribe. Really does help. And again, we'll see each other in the next video, hopefully. And you have a great day. Thank you very much.